Welcome to today's Explainer. Parkinson's disease is a daily reality for so many families, and navigating it, whether you're a patient, a caregiver, or really just someone wanting to understand, well, it can feel a little overwhelming. But today, we're taking a clear, structured journey through the realities, the science, and the management of Parkinson's. We're going to break down exactly what's happening in the body and how it's treated, step by step.
Okay, let's dive right into this. Here's our roadmap for today. First, what is Parkinson's disease? 2. Symptoms and causes. 3. Getting a diagnosis. 4. Management and treatment. And finally, 5. Outlook and prognosis. Let's get to it.
Chapter 1. What is Parkinson's disease? Let's cover the basics.
To build our foundation, we really need to grasp the sheer scale of this condition. Just look at this number. Every single year, around 90,000 people in the United States alone are diagnosed with Parkinson's. That is massive. It's an incredibly common condition, which is exactly why understanding the mechanics of this disease is so relevant to so many of us. Chances are you or someone you know has been touched by it.
Zooming out even further, there's an estimated 1 to 1.5 million people currently living with the condition. Now, what's absolutely crucial to understand right up front is that Parkinson's is a progressive movement disorder. Essentially, that means it's a condition that slowly worsens over time. But what exactly is happening inside the brain to cause this progression? Well, let's see how this builds.
It all really comes down to a chemical called dopamine. Think of dopamine as a highly specialized messenger in your brain, one that specifically helps control your movements. Parkinson's happens when the specific brain cells that produce this dopamine slowly stop working or actually die off. So when those brain cells die, that dopamine messenger, it basically goes missing. And without that messenger, the brain has a really hard time sending clear signals to your muscles. That breakdown in communication is exactly where the movement issues begin.
Now, there are two main types of Parkinson's we need to talk about. First up is the most common by far, idiopathic Parkinson's disease. In the medical world, idiopathic is just a fancy way of saying the exact cause isn't completely known. But experts do believe it's heavily linked to a specific protein in the brain called alpha-synuclein. Basically, this protein doesn't fold the right way, and it causes these clumps to build up. Those clumps are called Lewy bodies, and they are what ultimately damage those essential dopamine-producing brain cells we were just talking about.
Then you contrast that with familial or genetic Parkinson's disease. Now, this type gives us a slightly more complete biological picture, though I should note it's much, much rarer. As the name suggests, it actually runs in families and happens because of inherited gene changes. What's really distinct about this genetic form is that it often starts at a younger age compared to the idiopathic type.
All right, Section 2, Symptoms and Causes. Let's look at how this actually manifests.
So how does this lack of dopamine actually show up? Usually, symptoms start out very mildly. They progress slowly, and honestly, they often affect just one side of the body first. Now, we typically only think about the movement symptoms, right? The resting tremors in the hands or arms, the muscle stiffness, slowed movement, maybe changes in walking or balance. But what's really interesting here is that Parkinson's also brings a whole host of non-movement symptoms. Surprisingly, issues like losing your sense of smell or vividly acting out dreams, these can actually appear years before any of those movement problems even start. It truly is a whole body condition.
So, who's most at risk here?
Well, since the exact reason the disease develops isn't fully understood, which unfortunately means there's no known way to prevent it, we rely heavily on known risk factors. Being over the age of 60 is a major one, although early onset cases do sometimes happen before 50. It also pops up more often in males than in females. Having a close biological relative with the condition slightly bumps up your risk too. And finally, there's a really fascinating environmental link. Long-term exposure to certain pesticides or metals, like the manganese you often see in welding, can definitely raise a person's risk.
As the disease progresses over the years, it can, unfortunately, lead to some secondary health challenges. And we need to be completely frank about these. These potential complications include autonomic nervous system problems. That basically means the systems your body controls on autopilot, like blood pressure, digestion, or bladder control, they start to malfunction. Patients might also face cognitive and memory issues down the line, and increased risk of fall injuries because of those balance problems, ongoing mental health challenges, and trouble swallowing, which is serious because it raises the risk of choking or food accidentally getting into the lungs.
Moving on to Chapter 3, Getting a Diagnosis and the Clinical Evaluation.
If someone is experiencing these kinds of symptoms, what actually happens at the doctor's office? In our high-tech medical world, might actually surprise you to learn that a Parkinson's diagnosis is primarily a very careful clinical progression based on observation over time. There isn't just one magic blood test.
First off, a doctor reviews the medical history and discusses the symptoms. Then, they do a detailed neurological exam, literally just watching closely how the patient moves, how they walk, and how they use their hands. Finally, they might use imaging like MRIs or specialized DAT scans, but honestly, those are mostly just to rule out other conditions. Sometimes genetic testing comes into play, but primarily, it's all about observing how symptoms affect movement and evolve over time.
Which brings us to Chapter 4, Management and Treatment. Let's talk about improving daily life.
This is where I really want to inject some energy into our discussion. Because look, while there is currently no cure for Parkinson's, there are some absolutely incredible, highly effective management strategies that can massively improve a patient's daily life. Let's open up the medical toolbox here. The crucial point to remember is that most of these treatments are just trying to solve that original dopamine messenger problem we discussed earlier. Take a look at these main medication categories. First, you have carbidopa-levodopa. The levodopa part actually turns into dopamine right in the brain to tackle the slowness and tremors, while the carbidopa helps it work better and stops annoying side effects like nausea. Then, we have dopamine agonists. Think of these like chemical impersonators. They basically mimic dopamine in the brain to help with movement. And finally, MAOB inhibitors. These don't make new dopamine. Instead, they slow down the breakdown of the dopamine you already have, so it lasts longer. It's literally a masterclass in managing the brain's chemistry.
But hey, treatment isn't just about a bottle of pills. The care really has to evolve alongside the patient's changing needs. We also have continuous medication infusion therapies now. That's where medicine is delivered continuously right under the skin via a pump, which totally helps avoid those frustrating on and off fluctuations you get with oral meds. Beyond that, there's rigorous physical, occupational, and speech therapy to help folks maintain their independence. For more advanced cases where the meds just aren't cutting it, there's deep brain stimulation, or DBS. That's a surgical procedure that implants a tiny device in the brain to help dial down those movement symptoms. And of course, the whole shebang is supported by foundational lifestyle changes. Regular exercise, good sleep habits, solid emotional support, and a balanced diet, they play a massive role in day-to-day management.
And finally, Chapter 5, Outlook and Prognosis. Let's look at the road ahead.
Let's transition into the long-term realities for a second. What does life actually look like after a Parkinson's diagnosis? I want to pause here for a moment because obviously receiving this diagnosis carries a very real, very heavy emotional weight for patients and their loved ones. It pretty much forces a complete reevaluation of the future. But the reality of that future is often much more encouraging than that initial wave of fear might suggest.
Here is the absolute core takeaway I want you to remember from this explainer. Parkinson's disease is not usually fatal on its own. Yes, it's a long-term condition, and yes, it slowly gets worse. And how fast it changes varies wildly from person to person. But many people live for years, even decades, with the disease. The real secret to that longevity and quality of life is consistent, regular medical care. It's a willingness to adjust daily routines, and it's accepting support as your needs inevitably change over time. While complications can eventually develop that might affect life expectancy, the disease itself is something patients can actively manage with the right team in their corner.
Which naturally leads us to this final thought. With no cure yet, how might ongoing clinical trials and research completely reshape the future of Parkinson's care? Right now, scientists are hard at work studying new lab tests that look for those abnormal proteins, aiming to catch the disease earlier than ever before. Clinical trials are constantly exploring novel treatments. The medical landscape is moving forward fast, and it is offering some very real hope. Thank you so much for joining me for this explainer today. Keep learning, stay curious, and I'll catch you next time.